Hello, and welcome to Ethics and Healing House. I'd like to introduce our executive director and founder, Bobby Joe Reed.
Hi, everybody. Bobbi Jo here. I'm glad you're here to join us today.
So, Bobby Joe, before we get started, a lot of the people who are watching this video may not have ever met you before or know anything about Healing House. Do you want to tell us about Healing House just a little bit?
Sure.
Okay.
So, I am a person in long term recovery. I will have 30 years this upcoming September. Whoop, whoop. All the glory be to God for that. And I started Healing House because many years ago, when I went through treatment, there were only 30 safe beds for women to go to when they got out of inpatient treatment. And most of those beds were earmarked for women that had children. And so there were hardly no options for single women. And I was a single woman in recovery with no children. And the Lord really put on my heart to do something to help that that group of women. Now, of course, in the last 22 years, we
Mm-hmm.
have went from women to women and children, pregnant women, new mothers, men. So and families. So we accommodate all people in recovery.
Everyone know.
Yes.
Yeah. And if you didn't know, Healing House is the largest provider of recovery resident beds in the state of Missouri. So that's
Yes.
pretty incredible.
Yes.
So today we're going to talk just a entry level introduction about ethics and specifically ethics here at Healing House. So, if we're throwing around the word ethics, we kind of have to have a common understanding of what that word means, right? And so, for our purposes today, and this really is the definition of ethics, it's a system of moral principles that guide a group of people how to behave and make decisions. They help people determine what's right and wrong and how to treat people fairly and with respect. So, at Healing House, we want everyone to be treated in a certain way that fits within the culture of Healing House.
Absolutely.
So, you may ask, well, why are we even having this discussion? Why do ethics even matter? And so, some of the things when you think about having an agreed upon set of rules with folks, it's going to be to ensure that people are treated with dignity and respect, right? And it will help guide staff and volunteers in decision making. It promotes safety, trust, and recovery, and prevents harm that may come to our participants and reinforces best practice.
I think it's for the safety of the people that live here, as well as safety for the volunteers and staff members, because many times we are from two entirely different walks of life or have been in the past, and our addiction leads us to sometimes be not quite honest. We learn to manipulate. We have to. It's part of the disease of addiction. So we don't want anybody to get taken advantage of on one side of the coin or the other. So it's just kind of fair playing field. Also, I think one of the big things is, and I know you might not know as a volunteer, but whenever people start using drugs or alcohol, that's where their developmental skills stop. So if you started using drugs or alcohol at 12, you've got the coping skills of a 12-year-old or a teenager, right?
Absolutely,
And
absolutely.
so something that you might say in passing that you don't give a second thought to could be hurtful to one of the participants. And so we have to make sure we keep everything even, Steven, fair. I can't tell you how many times in my years of doing this I've heard, well, how come she gets to and I don't get to? This might have you have flashbacks to when your children were teenagers, and we quite often deal with that. So we try to keep everything equal for everyone.
Yes, absolutely. The other thing that comes to mind when I read this first bullet point about ensuring dignity and respect, I know that when I am also a person in long term recovery, and when I first went to treatment, there was practices were very different than they are now. And providers would say things like, look at what you're thinking got you, or obviously you can't think because if you could, you wouldn't be here. Like just some really derogatory things that really put people down. And we want to build an atmosphere and a culture where that is not accepted because we want to let everyone know that they are exactly where they are supposed to be and to learn skills to be able to go out in life and do much better than they have been. Because, like Bobby Joe said, often when people start using, that's when their development stops. So, a lot of participants, I know this was true of me, may seem really immature, and that is why.
I was looking at the look on my face a moment ago, and I was recalling when I used to go to a 12 step meeting, and they told me, take the cotton out of your ears and put it in your mouth. Don't say nothing because you don't know crap. And I was thinking
Yeah,
how offended I was that somebody would say, "Don't they know who I am?" Yes, they knew exactly who I was, and at the time, I did need to do that. But boy, did it hurt. So we try to avoid the old 12-step programs. Is are really different than what we're trying to do here. We're trying to encourage people and support people, but not to a measure of being hurtful. And so there's a important distinction. And yes, things have changed a lot since I came through 30 years ago.
yeah. When we know better, we do better, right?
Yes, right.
All right. So, the next thing that we want to talk about is just some principles of ethical care. The first is autonomy. We want to respect people's individual choice, right? So, there are so many paths to recovery. And I know for me personally, 12 step programs is absolutely what I need and needed, right? For other people, it might be returning to church or going to a smart recovery group. So we want to really respect that.
Absolutely. Freedom of choice is key. And for people to find, of course, we encourage certain things. One thing about Healing House is we lay truly a buffet of things out before each person that comes through our doors. And at first, they are required to attend all these different things. But as time goes on and they get to start picking and choosing their options, by then, nobody has a hobby when they get here. We
Yeah,
haven't been doing arts
no,
and crafts
right,
or golfing or
right.
whatever.
Going
We,
out and yeah,
yeah,
painting. That's
the hobby was chasing the dope man down.
yeah,
So now we're not doing that. So people need to see, quite frankly, people don't even know what they like to eat when they get here. That sounds so crazy to people that have never experienced addiction, but we lay this buffet out so people can really pick and choose the things that they find joy in, that we can celebrate together, the things that just fill them. It could be.
absolutely.
We have improv classes here, so people get to get up and laugh and have fun together. We have art therapy. We have an array of different things that people can just do to see what they enjoy. And you'll continue doing things that you enjoy, right? So that's the whole motto of just letting everybody, yes, we're all going the same direction, but many paths lead into one.
Absolutely, absolutely. The next is benefices. I think I said that right.
Mhm.
And what it is, right? I may not be able to say it, but I know what it is. And that's acting in the best interest of the client. So we always want to keep that in mind that we want to do absolutely what is best for the people who we serve, because that's why we're here. And then the next one I can say non-malfeasance, which is doing no harm. We don't want to do any harm to the people that we work with. And we're going to talk a little bit more about dual relationships, but dual relationships can absolutely be harmful, not only to the participant, but to the provider or volunteer.
Yes.
I've seen that time after time
Absolutely.
where people are like, "Oh, it's okay if we're friends," and then it's really not.
Yeah. And I've seen people with the best intentions of wanting to come along somebody's side and helping them. And then before you know it, they've created this relationship outside of our doors. And now all of a sudden, these great intending volunteers are getting calls in the middle of the night. This person has relapsed and left here. And now they're calling them with all these excuses why they need money, and they've got their cell phone number, so they're
Yeah.
calling them, and the person believes what they're saying, so here they are, they're starting to give them. It can just create so much havoc in everyone's lives. And so we really do have some pretty clear guidelines of what safety looks like for everyone.
Yes, yes. And I know for me, when I first started working in this field, um, one of the things that I had to be trained to do is how to tell people no about my cell phone number. No, that's not something that I can give you, but you can contact me here at the office during these times, and that's when you can find me. Um, the other thing that I want to talk about is justice, which I think you've already talked about, being fair and equitable to everyone.
Yes.
So I like to follow this rule. If I'm going to do something for one person, I need to do it for all. I don't want to pick and choose and have special people that I'm working for, because that's when you get into those unethical situations.
Let's use cookies.
Let's use cookies. Yeah.
Cookies is a great example.
Yeah.
So I can't just bring a little bag of cookies in for one person. If I'm going to bring cookies in, I'm not trying to get cookies from everybody, I promise, even though I do love cookies.
Yeah.
Instead of just bringing one person a small bag of cookies, bring a platter that I can share with the group. That way, nobody feels like she likes her better than me, or why is she the favorite? And like in our houses, we don't allow our house managers to sponsor people, 12-step sponsor in their house, because what that would do is they'd be spending more time, one-on-one time with that person, and then all the other girls think, oh, well, she likes her better than me. That's not the case. So we just try to really keep it clear cut so nobody's feelings can get hurt or them feeling like they're less than.
Right. And that is a great example. And I'm going to go with the cookie example. And the other thing that you don't want to do is give cookies to one person and say, don't tell anyone else.
Yeah.
So if you are even thinking about this needs to be kept a secret, then it's unethical and don't do it. That's a really good measurement, right?
That's right. I like that.
Yeah. And then fidelity, which is maintaining trust and honesty. We don't want to break trust. And at the same time, it's really important for you to understand as a volunteer and as a staff member, if a participant says, can I tell you something? And you keep it just between us. The answer is always no. I have to share this with the team, whatever it is. Right. Because yes, you want to maintain trust, and you also need to have that integrity and the honesty so that we as a team can absolutely help that person move forward.
And how would you feel if the person told you, I've been thinking about committing suicide, and you had promised to keep a secret and you didn't tell anyone, and then that person actually followed through? You would carry that guilt, shame, and remorse with you forever. And so it's just not worth it. And you can say you're more than, you know, you can share anything you'd like with me, but I cannot promise that I'll keep it confidential, because if it's something that it could be harmful to yourself or others, I would have to share that.
Yeah, absolutely. Um, I'm going to let you talk all about creating a welcoming environment and what, because Bobby Joe, you have been creating this culture for over 20 years now, right?
Yes.
So you are the expert on this. So I'm going to let you go with this.
Okay. One of the important things to me is that I don't, I think of examples that I've used throughout the years. I never go to anybody, if two people are having conflict, I'd never go in with the, well, you this or you that. We keep it in I statements, right? So I have noticed, right? And then we'll get into some trauma informed care language down the road, but also trauma informed care is like you never go up and say, "What's wrong with you?" It's more, "What's going on? Do you need to talk? I can see you're troubled. Is there anything you'd like to talk about?" Um, Culturally, to me, everybody here, I don't care what you did yesterday, what you did last year. I don't care what color your skin is. I don't care your, um, none of us have finances when we get here, but I mean, I don't care what your background is, if you come from an affluent family or as poor can be, does not matter to me. None of those things, none of that matters to me. What matters to me is that you have an open mind and an open heart to receive something different, right? So if we keep doing the same old thing, we keep getting the same results. So as long as people are willing to listen and to learn and to um, open up their heart and their mind to something different than what they're used to. Because, see, my own thinking, when you get here, it says in our literature we can no longer differentiate the true from the false, which means I've been buying my own lies for a long time. So at least people have to come in through our doors with some willingness. But it's imperative to me, sexuality is of no preference. I mean, to me, none of this stuff matters. The only thing that matters to me is that you have a problem and that you're willing to do something to fix it or help with it and do something different. So, and the other thing is when we come through these doors, the world has torn us up and we feel like we are not welcome anywhere. We we don't love ourselves and we don't think we're worthy of love, especially God's love for many of us because we've done a lot of things. And many of us have been liars, cheats, thieves, all the things that we do in our addiction. And so we don't need to point out people's flaws as much as we need to affirm what is good. Like somebody could say, "Oh, I haven't, I haven't got a job. I've been here 2 months. I still haven't got a job. Nobody's going to hire me." But say, "Listen, you've got 2 months without using drugs or alcohol. You've had you've had fixed a resume. You've got a great resume. You've got good character references. We're building up to that. You just got your high set diploma. You've been taking banking classes. You've made a lot of great progress." So instead of the things, it's it's very easy for the folks that we work with to get into the what they don't have instead of what they do have and what they have accomplished. So we like to the accomplishments, we like to bring them up, and then we'll work through the stuff that is more difficult. And with time, God fixes everything. Um, Stigma, I there is so much stigma when it comes to addiction in general. Did you want to say something?
I was just going to say not only the external stigma that we face, but also our own internal stigma. You already kind of talked about that, how people, whenever they come in, they're so torn down that that's really all that they can focus on is what they don't have and their deficits instead of their strengths. And I love that you said that we focus on their strengths, right? So there's a lot of stigma about a lot of different groups of people and about a lot of different things. And we've faced that both from other people and then our own negative self-thinking. Yeah.
I was thinking when we moved down, when I first started the first house down here over 20 years ago, this community was crime riddled. And I mean, pimps, drug dealers, prostitutes, gang members, all up and down. And I'm sure you've heard me say, but not 3 hours would pass without hearing gunshots. And I remember the reception I got. I was down at the hardware store all the time because the old nursing home that I got had so many repairs. And at one point, I heard that we were a brothel. And I was the madam, so at least I took up her billing, I guess. And I'm like, I can promise you there's no money to be made there. And then the other thing was, oh my gosh, there are a bunch of addicts and alcoholics. We don't want those people living in our backyard, is what they said, not in my backyard. And I really thought that was kind of hysterical too, because there were addicts and alcoholics all, I mean, everywhere in this community. But the thing is that all those people were actively using. We were going to be people in recovery, and people in recovery operate and act a whole lot differently than people that are in active addiction. And so throughout the years, we've fought some pretty big battles, honestly, for people judging. And, some people have talked bad about Healing House because we're Christian or faith based organization, and people automatically assume that we're going to hate on people. And that's the farthest thing from the truth. I mean, and here's what I want to say to follow up the neighborhood deal is that now we are very much loved and valued in this community. Absolutely. We are like the shining star of the community, and they've seen what we have done, and that we are good neighbors, and that we care for one another, we watch out for one another. And then people judging people, me and Darla do a training on by
implicit bias.
Implicit bias. And it's just when you look or hear about somebody and you assume, and we all know what assume means, right? And we've got to quit doing that. First thing, if you say a heroin addict, what's the first thing that pops in your mind? Right. I'm in recovery, and you're thinking of somebody dirty and filthy in an alleyway with a needle hanging out of their arm unconscious. That's not what all addiction looks like. Yeah. And so people addiction looks like me.
And like me.
And like Darla.
Right.
I mean, we clean up pretty good. We didn't look quite this good.
We look pretty spiffy.
But it's stigma. And so, and I recall, honestly, when I was in active addiction, my mom would always tell me, Sissy, whenever I was going to be around her friends or other family members, she would say, Sissy, make sure your makeup is done and your hair looks good and your nails are done. Because, see, to her, as long as the outside looked okay, then nobody would question or think, wow, what's going on with Bobbi Jo? As long as the outside looked good. And unfortunately, many of us have experienced that, and the funny thing is say in recovery, you're only as sick as your secrets. Mm-hmm. And I was in a secretive, sick family environment for a long time where we just showed people what we wanted them to see. But unfortunately, living like that never gets into the solution
Right.
because you're never getting honest about
Got
it.
to live in the light.
Absolutely. And so, you know what? And parents, and I don't know if you've had a loved one suffer from addiction issues, but bottom line is that it's shouldn't feel shameful to you or an embarrassment. It's not a reflection on your parenting skills. It's none of it's not shouldn't be a shameful thing to your
It's a
family.
disease.
It's a disease,
Mm.
right? And 1 out of 5 people will be affected by addiction, directly affected by addiction.
At some time in their life.
That's right.
Absolutely.
So it's nothing to be ashamed of. We got to talk about it to get into the solution. So I'm super, super glad you're here with us. You know what? I got 200 babies living here. That's the adults. And then a bunch of small ones. And we need all the help we can get.
Yeah.
So welcome.
Yeah, absolutely. And the only thought that I have to add to this regarding the use of person first language is there's a saying that if you want something to thrive, you call it a flower. If you want to kill something, you call it a weed. So, whenever we talk about people,
Oh, yeah.
I don't talk about people who have mental illness. I talk about people who have a mental health diagnosis.
Mhm.
I talk about somebody who has a diagnosis of uh, bipolar disorder or something, so that's what the person first language is about.
Yeah. Addict just takes you to a place in your mind, or alcoholic. So we use the terms substance use disorder
To cover it all.
to cover it. Yeah.
Right. And the last thing is addressing stigma when you see it. I love the culture here at Healing House. It is very warm, open, and accepting. And sometimes we have participants that don't understand that. So if you are seeing some participants displaying some stigmatizing behaviors or language towards somebody else, speak up and let them know that that's not okay.
Absolutely.
So the next thing that I want to talk about is the ethical boundaries, and that why those are important. We've kind of talked on it a little bit, but maintaining those professional boundaries, whether it's client, volunteer, or professional client, whatever. You want to avoid dual relationships, and dual relationships are those relationships that like I am a provider and now I'm also going to be your friend. You want to avoid that at all costs. That can get into some sticky situations like Bobbi Joe talked about. And, one of the things that people often think about whenever they think about dual relationship is intimate relationships. Well, that doesn't just happen overnight, right? It happens with the slippery slope. First, I'm going to give you my phone number, and then I'm going to pick you up and do things outside. And then if you look down at the next point, transparency and communication, if you ask yourself, what I'm doing, would this be something that I would be comfortable telling Bobbi Joe that I'm doing? And your answer is no, then stop. Don't do it, right? And then the confidentiality and HIPAA.
Absolutely.
Do you want to talk about that a little bit?
Yeah. It's not, and we've ran into this many, many times. Matter of fact, if you call and were to ask for somebody that lived here, you would be told, I cannot tell you if that person resides here. I can, however, take a message, and if they do, I will get them the message. And so we do not confirm or deny that the person lives here because people here are protected by HIPAA. And so that would be important. Say you lived in a certain community that had a clubhouse, and you were to go to a clubhouse event, and it would not be okay for you to say, oh, I seen the Joneses' daughter down at Healing House. She's in uh, she's in a substance use disorder treatment program. That would not be okay to do. I'm sure the Joneses would share that with the people that they chose to. So it's very important that we protect people that are here, and because this could be very hurtful. Like I said, there's stigma, right? So this could be hurtful to people, or if they're wrong, I've had people mess up and say, "Oh yeah, I met her or him down at the Healing House, that drug treatment program,"
Yeah.
and it's to an employer, and the employer doesn't know that person very well yet. Well, the first time that person calls in sick, they're saying, "Oh, she's probably drunk
Yep.
somewhere."
Probably using again. Yeah.
And so we don't want to do anything that could be harmful. Now, we ask that when people fill out job applications, that they're honest about that. They don't need to go in all the grave details, but if you put, "I have been convicted of a felony," put, "will explain," right? Because the person that you meet that's in active use is not the same person you're going to meet in recovery. And so it's very important to me. And I love that Darla touched on the dual roles. Um, when you get intimately close to somebody, and I'm not meaning intimate like touching, but sharing intimate information,
Details. Yeah.
very personal details about your life. Um, there's predators out there that will look for loopholes, right? That will look for some vulnerability to come in on somebody that you know like men. I've watched men in the past want to come to the women's rescue, right? "Oh, let me help you out. I've got money. I've got this and that." No, women stick with women and men stick with men. And that's because guess what? I don't have any motives working with another woman except for her to gain recovery. So if she's doing something that's not conducive to that, I'm going to tell her straight. I'm not going to say, "Oh, it's going to be okay." I'm not going to do that. I'm going to tell her the truth. So when you're sharing intimate things, and especially with people of the opposite sex, it can get very unhealthy very quickly because this person is confiding in you and sharing all this information. And, on some of that, even if it's another woman that's sharing with you, feel free to say, "I'm really not equipped to help you with this, but I know you have counselors and other peers that I'm sure you could discuss this with."
Yeah.
Yeah.
And also keep in mind that a lot of the people who we serve have grown up their whole lives in dysfunction,
Yeah.
right? And so they have also, sometimes what happens is people want to distract themselves by helping others, becoming overly
Mm-hmm.
helpful. So that intimate, detail that you're sharing, and maybe it doesn't seem like a big deal to you at the time, but maybe you're telling them that, you got arrested for something, or, that your feelings about some trauma that you experienced, something like that. You have to keep in mind that it is really easy for those roles to switch, and for the person who you're trying to help to start to want to help you,
Yes.
right? And we don't want that to happen either. So it's really good if you think of yourself as a race car driver and staying in your lane, right? um, and referring them to someone who can help them with all of that stuff.
Right.
Their counselor or their peer support or something like that. That's really important.
Yeah, just try to keep it. If you come here and teach Bible study, then be the best Bible study teacher there is, right? And, certainly if they say, "Oh, can I go with you? Can I
To
do
your
this
church.
to your
Will you pick
church?"
me up to go to your church?
I would tell them, "No, I know you're early on here. You probably just need to go along with what they're doing as the group."
What church they go to? Yeah.
Yeah. And, down the road, if that resident, gets farther in their journey and they decide they want to come visit your church, great, but they can do that on their own, right? So you just have to be careful of how, I would strongly suggest you don't meet people outside of here.
Ever.
Um, it's not
Just
it,
don't do it.
yeah, just don't do it.
Yeah.
It can,
And again, if you're not sure, then ask someone here. Ask one of the staff, ask Bobby Joe, if it's something that you're not clear about, because it's always best to check up on it if you really are not clear.
I'm okay with with somebody say, hey, I'm really struggling with this. Can you show me where that's in a Bible? And you want to print down some scriptures that might be conducive to what they're going through. Feel free to do things like that. That's totally okay. But just not too much outside of that.
Yeah. So now we want to talk about trauma-informed care, right? And I know that we talked about that a little bit earlier, but what that means is just coming to interactions with people, expecting that they have had trauma. We use a lot of information from the American Society of Addiction Medicine, and they have a stance, which I totally believe in, which is you should think of trauma as the rule rather than the exception.
Yes.
I know you have a great story
Yes.
about trauma and the number of people that have experienced that. So, do you want to tell that story?
Sure. So I had a young lady that came in that had the night before she got here, she had been raped by 6 men, and she was just shaking out of her skin and crying, and just like anybody would be.
Yeah. Yeah.
And so we were that day, that night, we were having a women's group. And so, just because she felt so uncomfortable, I said, ladies, if you're comfortable, by show of hands, could you please raise your hand if you've been a victim of sexual assault or domestic violence? There were 100 women in the room, and 99 women raised their hand.
Yeah.
And that honestly, it kind of blew me out. I thought it'd be about 3/4 of the women, but it was almost all the women.
Yeah.
And then in talking to the women throughout the years, I've had women tell me, no, I've never been a victim of domestic violence. My husband would choke me occasionally, but he never punched me.
Yeah.
And I'm like, honey, that's domestic violence. But whatever you're raised around is your normal. And so some people have lived in trauma their whole life, and they don't even recognize it as dysfunctional
Right.
or trauma because that's what they've been exposed to forever. So it seems normal.
Yeah, absolutely. And the other thing that I just want to touch on briefly is trauma's role in substance use. Sometimes people will start using or misusing substances because they've had a traumatic event in their life, right? And they just want to numb it. And sometimes when people are active in their use, they experience traumatic events because they put themselves in situations where there's a higher risk for something traumatic happening. And when that happens, it just kind of becomes this secular thing, right? So that you're trying to numb these feelings that you're having because of this trauma, and yet you're putting yourself in situations which could in fact become traumatic.
I'm going to age myself here, but there used to be a thing called a Sunday night family movie.
Oh, yeah.
I don't know.
Yeah.
Lifetime. I think it was Lifetime even,
Yeah.
and they're still corny movies.
Yeah.
But I remember watching a movie with my folks, and this woman had been raped, and her life completely fell apart. She couldn't be a mother anymore. She was losing her marriage. Everything just crumbled, her career, everything. And I thought, and I had already experienced a rape, several rapes by that point in my life. And I remember thinking, what's wrong with her? Why didn't she just move on? Now, she was having what would be considered the normal trauma response.
Right.
What I had already learned to do was not
Just push it down.
just push it down, just keep moving, stuff happens, just keep moving on and cover it, numb it, squish it down. And so I learned from a very young age, as many of us that have substance use disorder do, is that we just keep numbing. And so we don't have to deal with it, we don't have to feel it.
Yep, exactly. Exactly. And so if we know that about the participants that we are working with, that can help guide how we're going to interact with them, right? We definitely want to empower them and not control them. We are not the boss of anyone.
No.
And so, going back to that atmosphere and the culture that Healing House has created, it is definitely one of partnering with people on their recovery and not telling them what they have to do, but and also creating those spaces that are free from judgment.
I've heard people say, you just need to get over it.
Yeah.
What?
Yeah.
I mean, it's an individual journey.
Absolutely.
People deal with things differently. And so for somebody just to overlook somebody's feelings, so, I mean, to me, that's just something you would not do. It's, and I talked about it earlier. Don't say, what's wrong with you? Say, I see that you're hurting. Would you like to talk?
Yeah.
We want, and, I've heard some things throughout my years of being in recovery. One of my first sponsees was one of the most traumatizing things I'd ever heard in my life. And I remember sitting there thinking, no wonder this poor baby has used her whole life, These were awful circumstances. Of course, you don't want to allow your mouth to gape open or look horrified, or like gasp or, oh my gosh.
Yeah.
You don't want to respond to somebody in that way if it is, and there is second-hand trauma too.
Yeah.
Bless her heart, Mama Judy used to do all the screenings for many years. I did them, then Mama Judy did them. And then when Mama Judy passed, I went back to doing the screenings. And her desk was at the back of the room, and people would come into the office and sit in front of the desk and talk. And many times talk at me. And I remember on the screening days where these people were coming in and they were just sharing and sharing. And it was so bad. Many of them thought they had transmitters in their feet. They were being tracked. All this stuff, right?
Trauma responses.
Absolutely.
Yeah.
And I remember I could not wait to get out of that office. I felt like I needed to breathe new air because I felt like I had been beat up, right? Because it was one trauma response after another all day long, and hearing all these horrific stories and people's thoughts and where they were at. And so there is such a thing as second-hand trauma from listening to these things. So you be your own judge of that.
Right.
If somebody's bringing you a lot of stuff that you're really not
equipped to handle
emotionally
or to know what to say,
right, please say, honey, my heart goes out to you, but I am really unqualified to discuss these things
right.
with you because I don't know. But please talk to a counselor about it. And then you can notify a staff member that this person is struggling with these certain areas. We certainly don't want you to get traumatized as you're dealing with people with trauma issues.
Right. Absolutely.
Well.
Absolutely. Very well said.
Thank you.
Yeah.
And then what, non-judgment zone. Absolutely. We are not here to judge anybody. And, oh yeah. And, this is hard because I'm from an old 12-step program. We used to tell people what they needed to do, right?
Right.
But what worked for me or what worked for you might not work for everybody. And so it's really important that we allow people to find their own path. Now we can share our experience, strength, and hope with
And what
somebody.
worked for me, I can
Yeah,
definitely share that,
this is
right?
what helped me through this instance. However, you know, a lot of times you might say prayer and meditation, or reading scripture, or there's a multitude of things that people can do to get in when they're
Yes.
restless in
And I,
spirit.
I and I love what you said earlier about it being a smorgasbord and that people can pick and choose what they work, which is why whenever people first come to Healing House, they're exposed to all of it
Mhm.
so that then they will have options to pick from.
Some people,
I love that.
being out in nature, um, it brings them peace in their spirit. Some people, guess what? We have some bedrooms in some of the basements. They're finished of our houses, but some people have been traumatized in basements. And if I see that kicking off where they're like, oh, I don't really like basements. Okay, you're not going down there then. Okay.
Let's put
So,
you somewhere else.
yeah, we try to accommodate people where they're at and to their comfort level.
Yeah. Okay, now we're going to talk about some ethical decisions in harm reduction. And when you hear that word harm reduction, a lot of people have some preconceived ideas about it. It's got some stigma attached
Yes.
to it, but we all practice harm reduction every day, right? All of you have put your seatbelt on today. A lot of us, like me, use sunscreen every time I go out.
Because she's super pale, just saying.
I am.
No judgment.
Yeah, no, it's a fact. It's a fact. I will burn like
She
a
will
French
fry.
fry.
Yes.
And so that's harm reduction. So when we talk about harm reduction here at Healing House, we're talking about some of the things you've already talked about, meeting people where they're at and providing medications or access to medications for their substance use disorder or behavioral health disorder. If somebody comes in with depression, we're going to make sure that they get to a doctor that will prescribe a med for that. If somebody wants medication for their opioid use disorder, we're going to help them with that, and understanding that it's a client choice thing and we're going to reduce those barriers.
Right. So I came from, like I said, I came from a very stringent 12-step recovery program where it was total abstinence. And I remember pretty early on that a lady was coming in, a mother, and she had started taking antidepressants because she was horribly depressed. And I remember some of the old guys saying to her, "You're not really in recovery. You're just trying to numb yourself. That's not really what recovery is. You can't be on all that crap." Very judgmental. And unfortunately, she ended up taking her own life. And that was very clear for me to see that how dare them? They're not doctors.
Absolutely.
That they make that judgment call and jump down her throat for taking antidepressants. But what we found out through and Healing House was no, I mean it was pretty abstinent based, except for antidepressants, things like that. But as far as any narcotic medication or opioid medication, any medication for ADHD, any of that type of thing, we did not allow. But as research and time has transpired, we learned that there are tools for like Vivitrol for people that suffer with alcoholism. And there is medication, Suboxone, for people that struggle with opioid disorder. So there are tools that can be used and prescribed just as much as antidepressant medication or anti-anxiety. So we have really widened our horizon of what tools can be used to assist people, like with some of the opioid medication. It reduces, and also with the Vivitrol, it reduces cravings. And so when normally somebody would relapse, they don't relapse. They continue on with their journey of recovery with the assistance of this medication. So we really came outside the box thinking about what tools could be used and not looking at it as a band-aid
Or a
or
crutch.
yeah, crutch or, you know, we don't want to do that, certainly.
Yeah, absolutely not. So, I think that if we can just remember that we're not doctors and helping people get it what they need, that's going to be really helpful. The next thing that I want to talk about is managing some ethical dilemmas, right? There might be situations where you don't know what to do. And when in doubt, ask your supervisor or the person who is in charge of your volunteer situation. If it is urgent and your supervisor is not around and your volunteer person is not around, grab any staff and start having that conversation. Because, we don't want people to be in situations that they don't know how to handle.
Absolutely.
Yeah.
Especially, I mean, if anyone were to say to you, like I used the instance earlier, that they were having feelings of suicide or homicide or somebody was mistreating their child and they were going to go over, you need to please notify staff so we can intercede and talk them down and get into the solution.
Yeah.
So they won't get themselves in a predicament or something that could be harmful.
Absolutely. The next thing that I just want to talk about is some things that you can do to prevent burnout and what I like to call ethical erosion. So starting that slippery slope, right? Self-care, like in ethics training, you hear about self-care a lot. And the reason is because people who take care of themselves are much less likely to have an ethical slip and do something that is unethical. So self-care is way more than bubble baths and chocolate, right? It is about getting enough rest, enough, sleep, enough food. But it's also about setting those healthy boundaries. And so I know that we talked about phone numbers and not passing out phone numbers, but I'm also going to strongly encourage you not to accept Facebook friend requests or other social media requests from participants. And there's two reasons for that. One is now you're seeing everything that they're posting. And if you get some information from, I'm going to just say Facebook, then that's something that you got outside of this setting here at Healing House, and yet you're going to be obligated to share that, right? And the other way, you're sharing personal things that you don't really want participants to know. So I am a strong proponent of no friends social media.
I think that's really a good practice to have. I am not the guru on self care. I do go get a massage though, and my nails done.
And your hair.
And my hair
You do.
usually looks pretty jivey, but as far as I'm not really great at some of the self care.
But we all have room to grow.
Yes,
we do.
I figure I'll rest when I in 6 feet under.
Yeah.
Setting healthy boundaries. The hardest word for me to say when I got into recovery was no. Because I wanted everybody to like me. I wanted people, I just really wanted people's approval and I wanted to be liked. So it was very difficult for me to say no. And if I ever did say no, I would have to have the no with the because blah, 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 blah. And it was so empowering. It was really empowering when I figured out I could just say no. No, no, sorry, no. And not back it up with anything.
No is a complete sentence.
No is a complete sentence, come to find out. But it took me a very long time because I was we call it people pleasing. And we have felt like we haven't been accepted for so long. We want people to accept us in this community. And so very important
Would you
that,
just press that?
oh, yeah,
Okay.
very important that we can say the words no and not have to come up with an excuse behind it.
Yeah, it's a complete sentence.
And there's always more training to take. If this is something you struggle with or you're confused, we have trainings that you can attend, specialized training for different things, so you can let us know and we'll try to set you on the right path.
Yep, absolutely. So, in conclusion, I just want to say that it's important to commit to an ethical excellence here at Healing House, and that if you take nothing else away, that we strive for inclusion, respect, and dignity for each participant that comes through the door. I know that one of the things that Bobbi Joe has started is every participant that comes in, what do you say to them? Every participant that comes in,
welcome home, baby.
Welcome home. So we want this to feel like home for people. We will continue to provide education and ethical training throughout your stay here at Healing House. So I absolutely encourage you to take advantage of that.
And I want to say, Healing House is founded on love, respect, safety. That's one of my biggest things why we really created the home atmosphere, right? So, like when you go to grandma's house, and no matter what would be going on with you, you could flop down on her couch and you knew she's going to give you something good to eat and it was going to smell good. And you could just breathe out, right?
Because you were home.
You were home and you felt safe.
Yeah.
And, it's so important to me that we just love on the people, the brokenness and the trauma that people have experienced before they get here. We just want people to feel like they're finally home. And I hear that all the time. I've never had such a pretty room. I've never felt so at home anywhere in my life. Man, there's no better compliment to me than for somebody to tell me I've never felt anywhere like I feel here, like this is really my home. That's what it's about. And in saying that, I want you to know that you are loved, and I hope that you feel welcome and that you are home as well. So, welcome to the Healing House family. My little saying, if nobody told you yet today, God loves you, and so do I. So, welcome to the team. We appreciate you.
Absolutely. Thank you very much.